This section of lecture will cover autism. And so autism is a childhood disorder that really has two key symptoms. They are abnormal social development, impaired language and communication, and repetitive and stereotype behavior. So in terms of social development, individuals with autism tend to struggle to form relationships and respond to social cues and share experiences with others. So from early on, you see problems like a lack of eye contact. Kids with autism tend to struggle to get comfort from their parents. They're not good at reading other people's emotions, and they're less likely to have secure attachments. In terms of impaired language and communication, children with autism are less likely to speak altogether, or they often have delayed language development. Sometimes you'll see they have words, but they don't have very fluent language, and so they'll engage in kind of flat and robotic type of speaking, or sometimes echolalia, where they'll repeat the words after people. And then the final key symptom is repetitive or stereotype behavior. And along with this is kind of very restricted interest. So things like rocking or flapping of hands, being obsessed with specific objects, and extreme distress when the environment is altered. So these are the three key symptoms, but there is significant variability in the nature of the deficits and the degree of the deficits, which has led us to really, rather than just making it a black and white, either you have autism or you don't, it's led psychologists to really categorize this as a spectrum of disorders. So for example, on the milder end of the spectrum, we have Asperger's syndrome, where these individuals have normal to high intelligence, they have decent verbal skills, and they want to establish relationships, but tend to be kind of bad at them. So they have, less of the social problems and less language impairment, but still show this kind of abnormal behavior. So we now kind of combine the whole spectrum of autistic type behaviors into autism spectrum disorders. So there's a number of components to this social impairment related to autism, and this is pretty significant, and a lot of the problems stem from issues with social cognition. So social cognition is kind of how we understand ourselves and other people, how we understand emotion and think about it, and language and meaning. And so individuals with autism struggle to understand that other individuals have different mental states than our own. So theory of mind really addresses this point specifically, and so theory of mind is being able to attribute mental states to other people. So understanding that what I know is not always the same as what you know. So for example, if I hide candles in a Crayola crayon box and you come into the room, I know that you are going to expect there to be crayons in the crayon box. Very young children, typically under 4, and people with autism struggle to understand that the things that they know and the things that they feel are not the same as what others know and feel. So somebody with autism who knows that there are candles in the crayon box might expect that other people, even if they haven't seen what's in there, would expect that as well. Joint attention has to do with kind of understanding people's intentions. So this includes eye contact, pointing, and looking at the same thing. So if you think about kind of a typically developing child, when a parent points or looks, kids naturally follow their gaze. And kids with autism are much less likely to do this. Affective social competence has to do with kind of understanding experiences of emotion and sending emotional messages to other people and reading other people's emotions as well. We pick up a lot based on what other people say and how they express their emotions, whereas kids with autism tend to seem kind of oblivious to other people's emotions. They really don't have that emotional understanding. So in terms of the developmental course of autism, for nearly all children who are diagnosed with autism, it is a lifelong disorder. Characteristics, symptoms of autism are evident and generally peak between the ages of 2 and 4. This is when kids are getting into preschool, they start engaging with others more, they're really expected to have a fair amount of language competence, and so that's really when these symptoms, kind of red flags of this disorder, start to appear. Typically, lifelong, there are problems in kind of the neurocognitive domain, social communication and interactions, and behavior. Most individuals with autism will experience significant cognitive impairment, so they have significantly lower IQs. Sometimes you see individuals with autism having a special talent. So for example, I knew a child with autism who had pretty poor social functioning. He wasn't able to really carry on a typical conversation, but he had this amazing talent to take things apart. So he disassembled a chandelier one time. He dismantled his parents' garage door one time, and when they weren't looking, and so he just had this amazing ability to figure out how to take things apart. He didn't always use it to put things back together though. Normally we know that autism is a lifelong disorder. Often kind of the symptoms appear around between 2 and 4, but if you reflect back, normally there are symptoms before age 3. Typically it's not diagnosed until preschool, but it begins in infancy. So kids who will later go on to be diagnosed with autism have less social responsiveness. They don't orient to voices as much. They don't babble and coo like typically developing babies. They don't make as much eye contact or smile as much. The estimates of how frequent or how prevalent autism is vary widely, but the current official U.S. estimate is 1 in 88. You have 3 to 4 times as many boys as girls who are diagnosed, so much more common in boys. And 3/4 of kids on the autism spectrum also have some kind of intellectual developmental disorder. So you can kind of see from this table how the rates of autism have increased. So in 2000, about 1 in 50 children was being diagnosed with autism, whereas by 2008, the rate was up to 1 in 88. So we see this pretty dramatic increase, and I think a lot of this has to do with increased awareness of the disorder. In terms of what causes autism, one of the kind of historical causes was thought to be what they called refrigerated moms, or kind of unresponsive parenting. But if you think about what it's like to parent an autistic child who's not affectionate, who's not responsive, who doesn't smile, it's incredibly stressful. And so it can be really difficult and really frustrating for parents. Also, in the next point, we know that autism seems to be genetically based, and so it's entirely possible that the parents have mild autism as well, and therefore they're not very good at expressing these symptoms. So there's really not any evidence for it being a result of parent socialization. What we have the strongest evidence for is the influence of biology or genetics. So there's about a 60% concordance rate for identical twins, which means if one twin has autism, there's a 60% chance the other one will. For fraternal twins that only share half of their genes, the concordance rate is as low as 0%. If you look on the spectrum, in identical twins, 92% concordance rate. So if one twin has a diagnosis of autism, there's a 92% chance that the other identical twin will be somewhere on the autism spectrum. For fraternal twins, it's 10%. So what this tells us is there's a very, very strong genetic component. It's not 100% concordance rate, which tells us that maybe there's some environmental component, but certainly strongly influenced by genes. It's not a single gene, but there are many genes in several locations, which might kind of help explain the multiple different types of impairments that we see. Another kind of biological root cause of the autistic impairment is mirror neurons. So mirror neurons help us make sense of other people's feelings by relating them to our own. And so, for example, when we see pictures of happy or angry faces, non-autistic individuals automatically mirror those emotions. In contrast, kids with autism can mimic them if they're asked, but they don't do it spontaneously. So it's not these kind of emotional empathy kind of things do not happen automatically. Finally, autism has kind of been described as the extreme male brain. So stereotypically, females are more likely to empathize, they have good social interaction, good emotional intelligence. These are all things that individuals with autism are not good at, whereas males tend to be more systematic and very good at mechanical things. And so the idea is that autism is an example of extreme male brain. Families who have more kind of, quote, male-brained scientists, engineer type people tend to have higher rates of autism spectrum disorders. And one of the possible explanations for this is that we know that prenatal testosterone exposure can be associated with spatial and mechanical abilities, and so it's possible that prenatal testosterone exposure might also influence development of autism. Finally, in terms of the treatment of autism, generally long-term outcomes are poor, especially in a child that has significant cognitive deficits. We see improvements in functioning, but autism is not a disorder that people grow out of or that comes and goes. Generally, we see best positive outcomes if the IQ is over 70 and if kids have good communication skills by age 5. So in terms of what we do to help these individuals, medications are not effective. They can't really treat any of the symptoms. Sometimes they can be used to control hyperactivity that's sometimes associated with autism or obsessive compulsive kind of behaviors. And they can help kids kind of benefit from an educational background or from the education they're getting, but medication does not cure autism. The most effective interventions are cognitive or behavioral education programs. Getting them as early as possible and continuing them throughout childhood are really the things that help individuals function better. So a lot of these programs are built around reinforcement and reward to teach kids social skills and language. So reward them when they do things like say hi or play with peers or engage in inappropriate behavior. And so using kind of reinforcement to get the behaviors they want are the types of things that tends to help individuals with autism function. They never do those kinds of things naturally. It just doesn't come naturally to individuals with autism, but using behavioral training programs can really help them engage in this. So that is the end of this lecture.